We're live on YouTube.
Okay. Good morning. I'd welcome everyone. I'd like to, again, begin the Human Services Committee meeting. Thank you for those who are present as well as those who are joining us via Zoom. I'd like to have an approval of the minutes from the prior committee meeting, please.
I'll make the motion.
Supervisor Frazier, Supervisor Smith on the second. Thank you. All in favor?
Aye.
Aye. Any opposed? Thank you. Denise DeResta isn't going to be joining us this morning. The first item on the agenda will be a presentation via Zoom from Rob York. And after that is completed, we'll take a look at the budget, and County Administrator Moore will do his best to kind of run us through that. So I'd like to welcome Rob York to the meeting. Good morning, Rob. And he's going to be discussing the peer-to-peer program.
Okay, just thank you very much. I just want to also ask if Administrator Moore wanted to do anything further in terms of introducing the item.
I sure would. We over the past, I don't recall exactly how long ago it was. I want to say it was about a month ago. We may have been a little bit longer. Our peer-to-peer coordinator resigned. And we had a discussion last Friday with our counterparts over in Washington County about how we want to structure this program going forward. We discussed a couple of different models for doing so. And I think that it was fair. It's fair to say it was there was consensus fairly unanimously among us and among Washington County that we want to try to, rather than operate this program under the model of having a county employee, and we've had a part-time employee that's been our model, rather than do a model of a county employee working under one or the other of the veterans departments and carrying out all of these functions. We want to explore the possibility of having the mental health department do an RFP for an agency that is out in our counties that is working in the community to take over these duties and contract with us under the oversight of the mental health department. So that we all thought that there were advantages to doing that, and that would be our recommendation. And Rob can speak to a little bit more of the specifics as to how we would do the RFP and how we would structure the program.
Yep, and so for those not familiar, Joseph P. Dwyer Peer Services Program was an initiative, it is an initiative by the New York State Senate. And so it's Senate funding that was initially done as a pilot program with 4 or 5 counties. And then each year they've continued to add counties. And so our counties were added on several years ago. And it's a joint program, both Warren and Washington counties. We receive $185,000 for the 2-county program. Initially, we set it up so that it was under the county. We thought that maybe that would be less stigmatizing, trying to have it closely attached with our county veteran service agencies. But after a couple of tries here at different coordinators and trying to implement the program, we've reverted back to the idea of going out to RFP for this. There are some innovative programs we looked at across the state. Rensselaer County is doing something through the Hudson Valley Community College through their Veterans Resource Center at the college. And I know SUNY Adirondack also has a Veterans Resource Center. We have some mental health agencies in the community that might be interested in applying. So we think we're going to, I'll take responsibility to write the RFP, and we'll issue the RFP, and we'll see what kind of responses we get. And then we'll bring it back through committee for decision making. Any questions? Okay. Thank you.
Does anyone have questions for Mr. York? Okay. So we'd like to discuss the 2022 budget request for Veteran Services.
Okay, if you flip your agenda packet over, you'll see two cover pages. The first of which is budget for budget code A6510. That's the Veteran Services Department itself. And then the page opposite that is A6510-0125, and that's a sub-department for the peer-to-peer program. The peer-to-peer program is budgeted tax levy neutral. It's 100% funded by state funding. When this budget was done, it was under the current law, if you will, assumption that we continue the program running the way it's running. What we would do as we figure out a way to contract this program is we would just do a budget amendment next year if we're successful in getting this into a contract. And again, whatever we do there, it's going to be a 0% impact on the county. So we'll just fix those accounts up when we know how it's going to run. But with respect to the Veteran Service Office, you compare the 2021 adopted column to the 2022 department request. You can see it's fairly the same budget, $10,000 in revenue, and the expenses are projected, at least the requested expenses would be projected to go up just slightly from 202,000 to 208,000. I'll do my best if anybody has specific questions about that budget.
Mr. Chairman,
Yes,
thank you. May I direct it to?
sure. Yeah,
Thank you.
please.
Ryan, I don't know how this plays into it or even if it does play into it, but I do know, I think it was a month ago, the board approved a $5,000, an increase up to $5,000 for their credit card based on peer-to-peer. Is that going to be affected at all?
Well, the reason, and this gets to the issue of why it was difficult to do this with staff. Staff in both counties, whether you're Warren or Washington County, we have very stringent protocols that we need to follow in making purchases. We have an auditor's office. We have a process where the treasurer will write a check, included in batches that typically go out. And for the peer-to-peer program, there was a need for more flexibility sometimes with issues and events that came up that were more difficult to anticipate and to work into that schedule.
Mm-hmm.
So that was why we handled in this program, we handled a certain amount on credit cards and why it was desirable to increase the credit card limit. So if we were running this program with a contractor, it would no longer be in the mix to utilize a credit card. The contractor would essentially be going out and making the expenses utilizing their internal protocols, and we would be paying them the whatever fee we negotiated. So that would no longer be in the mix.
Thank you.
Doesn't provide any budgetary savings though.
Thank you.
Sure.
Excellent question. Thank you. Does anyone else have questions or comments regarding either the Veteran Services budget or the peer-to-peer agenda issue? Thank you all. We'll move on to the Countryside Adult Home agenda. We have Amy present with us to answer any questions. And first we have a notice of intent to fill part-time institutional aid number 18, grade 3, due to promotion and backfill any other positions caused by lateral movement. The rationale to that is that position is mandated and 50% reimbursable. Do I have a motion to bring that to the floor, please? Supervisor Shepler
I'll second the motion.
and Supervisor Frazier on the second. Amy, could you walk us through that matter, please?
First, I want to say
I'm embarrassed to admit that I thought I had deleted the part about backfilling and saved it before I printed it, and I didn't. I realized I cannot backfill. But the position is 20 hours. There is no benefit. But I find it to be an important position because we've cross-trained this person, the person that was just in it, and she was willing to work in different departments within her grade, and it's worked out really well. She has just since gone into a position with more hours.
Any other questions or comments on that particular matter? Do I have a motion to approve?
Motion.
I'm sorry. Again, all in favor of the request, say aye. Any opposed? So moved. And if you could walk us through the census and overtime reports, please.
So in August, our census was 32. It's currently 34. And I have 3 pending coming in by the end of the month. An interesting thing I want to mention is I found that when I was getting referrals that people were really interested in the private rooms. Well, we only have 5 and they're full. So I emailed our contact at the state and asked them, what could we do? And he said, as long as I wasn't changing our capacity, our bed capacity, I could designate a couple rooms as private, but not on a permanent basis. So if they empty and I have 2 referrals for TA, then we would go back to that. So right now I have 2 more privates and they're spoken for. So we have 7 private rooms now. So that's a good thing. And I anticipate with the referrals that I'm getting by the beginning of October, our census should be probably about 38. So I feel good about that.
Any other questions or comments for, yeah.
What is our maximum capacity? Thank you.
It's 48.
Thank you.
There being no, go ahead.
So, and then into overtime, you can see that we are actually below last year. And if you look, we had 2 payrolls, March and May, where we had no overtime at all. The staff is amazing as far as being flexible.
Great, thank you. Any other, again, questions or comments, please? Amy, thank you very much for your time. Be well.
Thank you.
This morning, you all should have received, of course, last week at the agenda email to us, but the committee meeting agenda for social services, as well as this thing document, which is the budget for specific programs and activities. So I will ask the commissioner to run us through the first 5 items, which are request to intent to fill. Actually, let's do the first one. Chris, if you could run us through item number 1, please.
Good morning, everyone. The first item that I have is a personnel request. The notice of intent to fill a position of caseworker number 35 in our CPS unit, Child Protective Services. It's a grade 16, and this is due to a resignation effective September 17th. The position is mandated and reimbursed.
Motion to bring that to the floor, please.
I'll make the motion.
Supervisor Frazier and Supervisor Smith on the second. Any discussion or questions for Chris? I will call the question. All in favor?
Aye.
And any opposed? Thank you. So moved. Number 2, please.
Number 2 is a request to amend the county budget. This is to increase revenues and expenses in the amount of $10,894. This is to reflect the receipt of an allocation from New York State Office of Children and Family Services for our APS unit, the Adult Protective Services unit. These funds are being made available to states to provide APS with resources related to their response during the coronavirus public health emergency.
A motion to bring that to the floor, please. Supervisor Smith and Supervisor Shepler, thank you. Questions or comments for the commissioner? Great, I will call the question. All in favor?
Aye.
Any opposed? Thank you, so moved. Number 3, please.
Number 3 is a request to again amend county budget to increase revenue and expenses. This is in the amount of $25,000 to reflect the receipt of temporary assistance for needy families funds from the New York State Office of Children and Family Services. This is for non-residential domestic violence programs and services for 2021 through 2022.
Thank you, Chris. A motion to bring that number 3 to the floor, please.
I make the motion.
Supervisor Frazier
Second.
and Supervisor Shepler, thank you. Discussion or questions for Chris on number 3? Thank you. I'll call the question. All in favor?
Aye.
Any opposed? Thank you. So moved. Request resolution number 4, please, Chris.
This is to submit our New York State Office of Children and Family Services RAP plan, Resource Allocation Plan for 2021 as outlined on the attached number 4. This is to request authorization to continue contractual agreements with Warren County municipalities, towns in the county and the city of Glens Falls. This is to reimburse a portion of the cost for recreational programs and community youth service providers for outlined programs. The funds are allocated each year to provide youth recreation programs throughout the county.
Thank you. A motion to bring that to the number 4 to the floor, please.
So moved.
Supervisor Shepler, Supervisor Smith, thank you. Discussion or questions for Chris on number 4? Okay, I will call the question. All in favor, say aye.
Aye.
Okay, any opposed? So moved. Thank you. And request resolution number 5, please, Chris.
The last one here, number 5, is to request a resolution to authorize continued agreement for a Council of Prevention of Alcohol and Substance Abuse for the Youth Court Program. This term would commence in the beginning of the year and end at the end of the year for a total amount not to exceed $60,000. The Youth Court Program improves the county's capacity to support youth development and to deter youth from further involvement in the criminal justice system.
Make a
A
motion.
motion, thank you, Supervisor Shepler and Supervisor Smith on the second. Questions or comments for the commissioner on number 5? I will call the question. All in favor of approving, say aye.
Aye.
Any opposed? So moved. Recently, I was invited and participated in the budget review process, the preliminary budget review process. Thank you to Chris and Julie for preparing a lot of good information. For those that you don't know or sometimes forget to realize how many different moving parts and programs and services that Department of Social Services administers. Some very big, some very small, but it's my experience that it takes the same amount of effort and time to administer a $50,000 program as it does a $2 million program. So thank you for your time and efforts. Julie, do you want to kind of run us through what you've submitted to us today?
Sure. In the front of your packets, there were 2 cover sheets so that you would have an overall view of our programs. and what we are asking for 2022, and also the projected revenue and the projected county share. I did two because one of them includes the meal sites at Countryside, and one does not. It does make a small difference in the amount of the county share. So I did two so you could see what it would look like if we renew the contract for the meal sites, and then what it would look like without the meal sites. I also included a sheet that has all of our programs. So if you want to follow down through, you can kind of see what each program, the service provided, and how much it costs us for each service provided. So if you start at the top with the 6010, that's our administration. That's all salaries, benefits, operating expenses such as rent, security. There's quite a large expense increase here from last year, and that is because our 6129 state training school program, we no longer get billed for state training program. We had to put the cost into the admin budget because now it's a bottom line adjustment. The state takes their money first. So the money I would have put in 6129, I had to put in our admin costs. And that estimate is about 350,000, and we're a little nervous that it's too low. We're just hoping to stay within that amount. As you go down through the rest of them, our daycare, that is our allocation. For last year, we've spent well under because there just haven't been a lot of daycare services with COVID, and we're hoping to really get that up and pushed, and daycare centers starting back up and being able to utilize it so that we can get people back to work. The next one is our Title 20, which is service for recipients, and that's 100% reimbursable, so there's no cost to the county. That's for our APS programs, it's domestic violence. And then our next one is Medicaid, which is always a challenge to try to figure out our weekly share because it is 100% county cost. I worked with Brian on this so that we could kind of have a mutual agreement of what we feel will be a very close estimate to actual costs. 6101, I also eliminated that because with low costs health insurance, we're not seeing the need for it anymore. People are going online at the marketplace and getting their medical through that. 6109 and 6119 are our foster care programs. We do have allocations, some county costs. It's trying to figure out what kids we have depending on how they're coded, is how much reimbursement we get for each child placed in foster care. The biggest expense why I had to increase the 6119 a lot was because of our education of handicapped. We're getting a lot more kids into that program, and of course we pay the maintenance piece 100%, and the education piece is reimbursed 58% by the school district. But we have to have the money up front. So there is a large increase to 6119. 6123, I did leave a little in there because we do have one child that's kind of been in and out of this program. So it's just, I left a small amount hoping that once he leaves, he won't be coming back in. 6129, I already talked about. Then 6140 is our safety net program. Safety net is when all other programs have been exhausted. It provides shelter, NIMO payments to prevent shutoffs. This is where all the county burials are paid out of. I kept it the same as last year. Our numbers seem to be fairly steady. When I did annual, it runs about 168 cases a month. 6141 is HEAP. That's just kind of a flow through admin fund that the federal government pays. (6142) is emergency aid to adults, and what that does is supplements our SSI clientele. And then the big one is our youth bureau. We have 7311, 12, and 13, which we're combining into one. The Alive at 25, we have not run this year. Very few last year. We just didn't have the kids, and with COVID, it was no longer viable. We had to get somebody in to run the program, and they were not willing to do it for 4 or 5 kids every couple of months. So all of that went to Washington County. So for 73, 12, and 13, we just want to contract our whole youth bureau allocation to Washington County, and they will run all of our youth programs. The total cost to Washington County would be $105,000, with $85,896 being reimbursed. So the cost to the county actually is a little bit less than when we were doing the youth corps piece of the youth bureau. So we saw a little cost savings there. And then if you move down to countryside, that's where the 2 sheets are different until a definite decision has been made regarding the meal site. I have the higher cost if it includes the meal site, and the lower cost without it. And once a decision's been made, we'll determine which one it'll be. The overall county share increase was less than 1%.
Thank you, Julie. Does anyone have questions or comments for either Chris or Julie on this matter? Supervisor Hogan. Yeah, oh, sure, yeah.
Thank you. Can you tell us more about the Washington County youth programs, at Washington County running all our youth programs?
Yes, I can. I've actually discussed this a couple times at prior committee meetings. One of the things that I really wanted to do over the last couple of years was improve our youth bureau and its functions and the services that we provide to the communities within our county. We just haven't really been able to get up and running very well with youth bureau. Usually in most counties, there's actually a separate department, which is the youth bureau. We dissolved our youth bureau probably around 2012, I think it was, for reasons that I don't know. I wasn't involved in that, but I've been kind of serving as the youth bureau director, which is unusual for a commissioner to do that simply because they usually have their own director. We have worked closely with Mike Gray in Washington County on a lot of different things over the years, including our probation department. He is actually the director of the youth bureau in Washington County. There's a couple of counties out in the western part of the state that years ago combined to make a dual county youth bureau. So we were thinking, maybe we should try that. So we entered talks over the last year, spoke about the advantages. There really were no disadvantages. And as Julie mentioned, there's actually a little bit of a cost savings for us. And Mike Gray will be able to assign a specific staff member who will be able to run these programs very well and provide a lot more services, including some job training stuff and things like lifeguard training, which I know is a big issue because a lot of places in the county are struggling to get lifeguards. The other nice fact is that all the money that actually goes out to the individual towns in the city of Glens Falls will stay exactly the same. That is one of the things that I initially told Mike. I said, listen, if we do this, none of the money's going to change to our communities. And he was fully on board with that. So that's a good piece of it too. So at some point, I will probably bring Mike Gray in here to meet everyone, maybe at a committee meeting or something before the end of the year, because at this point, it looks like we're going to be merging in 2022. Exactly. Yeah, it won't be a combined youth corps, but
No, I believe Youth Corps is going away. There really is not being utilized. They're going into more parenting, big brothers, big sisters, that kind of thing. They are contracting with the Council for Prevention. It just won't be Youth Corps per se. It'll be other programs that they provide.
yeah, so we'll essentially be combined. It'll be Washington Warren Youth Bureau. He will, anything that takes place in Washington County, he will go to the Board of Supervisors in Washington. Anything in Warren, he will come here. So we're really excited about it, actually. It's going to be, I think, a good collaboration. You're welcome. Any other questions?
Yes, I do.
Yeah.
I'm just curious about the numbers for 6109 and 619, the foster care. What kind of numbers are we looking at that are participating in this program? I'm just looking at the budget for it and think must be an awful lot of children then that are involved. Is that correct?
Yes, there is.
Yes, there's a lot of children that are in foster care. And the expenses have grown enormously over the years.
Mm-hmm.
The good news is that we actually are spending less than we used to overall, and we have less kids in care, due primarily to the types of placements and the associated reimbursements that we get through the various funding streams. But yeah, it is a big number.
Wow. Okay, my second question. We have this, says meal site not included, meal site included. What seems to be the problem there as to whether it's going to be included or not included?
Amy,
Go ahead.
want to take that one?
I could take that one.
Oh, please.
The-
That's good. I'm just curious.
Thank you, Ryan.
When this budget was put together, it was put together very much in the context of where we were on August 23rd,
Right.
where at the time it wasn't decided whether mom's meals was the primary option or whether it was going to be a fallback option. Since then, we've determined it's a fallback option. We're trying really hard to get people hired to the countryside, a meal site that services Warrensburg and Cedars. So this was on here as stage directions, if you will, to the budget team. I believe the current budget request reflects the meal site operating.
Yes.
Yeah.
And these were notes to us as to changes in expenditures and revenues that would need to be made if it was settled that the meal site was not going to operate. So these would be changes that we would not be making. It was an FYI to us as to what would need to be adjusted in that event, in that situation.
All right, thank you. Now, is the big problem there then staffing? Is that what the question is about?
That's right.
Okay, thank you.
And I'll inform people that I think it was over the weekend, I saw an advertisement on social media promoting or asking people to consider working at the various meal sites throughout the county, not just the ones that are understaffed, but also consider, looking for employment opportunities at all of them. Hopefully that situation will get resolved sooner than later, so we can, that all communities will be running the types of programs that they want to, not have to at this point. Supervisor McDevitt.
Yes, thank you, Ben. Can I just, it's okay to
Sure, yeah.
change the topic a little bit and just maybe ask a general question if I can. Yesterday, I was reading an article relative to childcare and what's occurring nationally. And according to this article, childcare providers nationally in some parts of the country are having difficulty opening their doors. They just can't find people. People within that industry have moved into higher paying jobs. So when we have an industry that is regulated by law in terms of the number of childcare providers, but by age category of children, it becomes a demanding environment. So this appears, unfortunately, really unfortunately, to be occurring nationally. We have an industry that is extremely important in terms of our just quality human beings as well as our national economy. So I guess my question is this, and there's probably no answer, maybe locally, is are you seeing that trend occurring, within our environment in terms of just the difficulty and finding people and just creating a situation where, if we can't provide those kind of services in an adequate fashion, we got problems.
Yeah, it is certainly a problem. We have less child care providers than we used to. Some of the reasons are, more stringent qualifications and regulations. There's also been changes to some laws that people look at and say, well, I don't think I really want to do this anymore because there's a whole host of things out there in terms of exposure to liabilities that they're not willing to expose themselves to for the amount of money that they're able to make. So there have been people who have decided to do other things other than open up a daycare or reopen a daycare in the case of daycares that have closed during COVID. So it is a trend. It's not quite as bad around here as it is in some areas of the country, but it's bad enough so that does have an effect. It's one of the things that we're working on. We have a couple of initiatives going with employment training as well to try to see what we can do about, drawing some more people into the, the business of childcare.
Okay. Thank you.
You're welcome. Any other
Excellent
questions?
questions and comments. If I can just ducktail on to Peter's comments. I had mentioned at a previous meeting, maybe last month, that many of the individuals who have been criticized for not returning to work are the very same people who have a 3- and 5-year-old at home and no place to take them. So not wanting to get a CPS report on them, they have to stay home because they have no place to take their children for childcare needs. So before, sometimes before we criticize those individuals, we really need to know the entire story that's existing with them. I'd also remind folks that certainly with a real comprehensive budget, if you have questions, the budget officer, the county administrator, the chairwoman, and all of your colleagues, talk to them about your questions and concerns, and so that at the end, we make sure that we put together a real budget that's going to work for us. So engage in conversation. Does anyone have any other questions or comments about for either Chris or Julie at this time. Is there any other thing, is there anything from the public comment from the public? Mr. Lehman? Folks that were on, watching us on YouTube? Not hearing anything. I'll move on. Have we covered everything, Chris?
Yeah, I think I would just like to add one thing
Sure.
in regards to our budget
Okay.
and the process.
Sure.
I'd like to really thank Julie for doing a great job on this. This is obviously a very detailed budget. It's a large budget. It's super complicated. There's a lot of moving parts. And she works on this for months before we actually present it to the budget team. I'd really like to thank the budget team, everybody that was there, because it's kind of a grueling process to go through every single page. Today, what people saw was just a condensed version of the important points. But at the budget process, the elected officials and county executive Ryan Moore asked very detailed questions. And they paid attention to every little thing that we had to say. And it's a long process. So thank you to everybody who's involved in that and the support of our budget. We try to do the best we can to be fiscally responsible and conservative as well. So thanks to everyone here, especially Julie.
I agree 100%.
Thank you.
Thank you.
Any other questions or comments? If not, do I have a motion to adjourn the Human Services Committee meeting? Supervisor Shepler
Second.
and Supervisor Frazier. Thank you, everyone. I think health services
Thank you.
is on
Thank
this
you.
month. And again, I think this was a one-time switch in the schedule, and thank you for those that were able to accommodate them. I'm going to be